that gets to the root of why modern health exists is there's this huge barrier to access of care. So I've gone through this several times and once went through as a thought experiment. Let me call the list of providers that I get from an insurance company. So I got the list of 50 providers. I called every single one of them. Nobody answered. 2 called me back to say, so sorry, but I'm actually full and I have no spots. And I was really thinking, I'm a psychologist. If it's this hard for me, like how hard is it for other folks to get access to care? And if you're experiencing depression, you're not making it past number 1 or 2 on that list, and then you're giving up and not getting access to care. So it's really 2 pieces to that access problem. 1, how do you make it really easy to find somebody who's a good fit? And then how do you make sure you can actually get in to see them? So we've developed something that we call the MAP system, where essentially we have a dynamic provider sourcing model where when we're starting to work with an employer, we'll take a look at their employee footprint, where in the world they are, what languages they speak, how many employees there are, and really apply some assumptions around how many people will need coaching, how many people will need therapy. We'll take a look at our existing network and say, do we have enough folks in this region? Do we need more people who speak a particular language? And then add those providers as necessary. And what that allows us to do is make sure that 1, we're in really close contact with our providers all the time. We know their availability. But 2, we don't have a lot of providers that are waiting around for referrals, which is not a great experience for them. But then also, how do you make sure you're in close enough contact with them that you know how many spots they have? So if you refer someone to that therapist or that coach, they can get seen that week. And I will give all credit to our VP of Ops, Tim, who's a wizard on that, because I think that's a big step for people to take.